our slogan is, it's about our community. And it really is. I know that all the administration focuses on what can we do, how does this affect the community, what decisions we make, how does it affect the community. We spent time this year, or actually last year, doing a strategic plan, a 5-year strategic plan of what we're going to be doing to help improve patient care, patient experience, patient quality metrics. All those kinds of things are very focused on our community. My DBA, Deb, came to me and said, I want to access eForms. And we had a previous, company. I don't know. We don't need to go over the previous company. But what it came down to was support. We saw the integrations that could happen. Being part of Meditech is, a phenomenal, integration that everyone loves. I know that Meditech themselves uses Access eForms for their forms. So that was a big, kind of like, oh, well, if this is the company that they're using for their own forms, that should speak volumes to the kind of product that they want to have and we want to have on our campus.
My role is I take care of the people that take care of my patients. The biggest problem that we had, one of the biggest problems, is that every clinic wanted their consent to be a little different. They wanted it to say something different. So then we would have to take it to the forms committee here at the hospital. They would have to approve it, and then we would have to, we would take it to the print shop. It would be printed off, and then that was just a cost. And so then you would either, if people ran out of those consents, they would just make copies of them, which was awful. It looked awful. And then you scanned it in. And
you're talking about copies of copies of
copies of copies of copies. And then it's like, and by the time you scan it in and it gets in the chart, you can't hardly even read it. And so that was one of my big things that I did not like. Before we went with Access, I didn't really even think about the cost of like the paper, and then the time that patients or that our staff were using to scan in paperwork. And then we have the shredder, and then we have scanners that they have to be fixed or maintained or whatever. And I thought, gosh, we have really cut down on a lot of cost.
So now that we've moved on to Expanse, it is a much better product. We can see what they do. If a patient goes to the emergency room, if a patient goes to specialty, that specialty wants certain labs done, we can see that order in their chart. And so what's great about the Access now is we can look to see in this patient's chart in Expanse if they have been to another facility, if they've been to a specialty facility, they've signed that consent for all clinics. We don't have to have them fill that back out again for another year. It's great. You don't have the repetitive paperwork that you would before. And so being integrated together with the specialty clinic, with the hospital, they may only have to come here and sign one e-access form compared to many as before, because each place had its own forms. And so now they come here, we bring up their registration, we see that they have signed what they needed to sign, and we get them checked right in. Their insurance cards are in there, their signatures are in there, their consent to treat, their, protected health information forms are signed. So, that makes it better for the patient. That makes it less time consuming for the patient and for us as well, because we don't have to scan those forms in now because they're already into our system.
I would say service is the key differentiator between products. For example, receiving support for my Microsoft product versus receiving support from a vendor that supports Microsoft. When I call for the same issue, the service I get from the vendor versus from Microsoft are phenomenally different. Therefore, I'm more inclined to go with the one that provides me the better service. I know that Meditech themselves uses Access eForms for their forms. So that was a big, kind of like, oh, well, if this is the company that they're using for their own forms, that should speak volumes to the kind of product that they want to have and we want to have on our campus.